Good evening and a very warm welcome to this edition of the Limelight. My name is Timapolo and we are speaking the fight against Ebola. Now, this week on the 11th of January, the World Health Organization declared Uganda Ebola free after 4 months of the epidemic that broke out 4 months ago. And in this fight, it is not the first successful story Uganda has registered against Ebola. According to the World Health Organization, the outbreak was successfully controlled, and in their own words, the fight was a robust and comprehensive response. But there are many issues to talk about around this fight, in which 55 lives were lost and hundreds survived. We will link up with one of those people who were at the front line of this fight against Ebola in Kasanda and Mubende districts. And he is Dr. Nahabwe Aaron. Dr. Nahabwe Aaron, you are live on Salt TV, the Limelight. Let's go straight and talk about this fight. Tell us, you as the people who were at the front line, how can you describe this particular fight against Ebola compared to the previous fights against the same virus?
Well, thank you very much, our host tonight. My name is Dr. Nahabwe Aaron. I'm a medical officer at Mulago National Referral Hospital, and the Chair Welfare Uganda Medical Association. And I was privileged to be among the frontline health workers in the Mulago Ebola response team. I would describe this epidemic as one other serious epidemics that have attacked us as a country. I would like to recommend and applaud the brave health workers that confronted it, and to the extent that within a record less than 4 months, we have put this outbreak to a halt. And thank you very much, the Ministry of Health team, all hospitals, all health workers, for the fight well done. It was scary, just like all Ebola outbreaks are. Mind you, this outbreak was declared on 20th September 2022 after a case was detected in Mubende Regional Referral Hospital. And this particular case, a 25-year-old man came in with symptoms of intestinal obstruction and vomiting blood. And so the team thought this could have been a complicated peptic ulcer disease, and they took him to theater. And while they were doing the operation, unfortunately, this man died on table, what we call death on table. And of course, during such an operation, once someone arrests, we call it arrests, the team tries to resuscitate or to try to bring them to life. During that process, they got very closely in contact with this patient, and all the team of 6 health workers contracted the unfortunate Ebola. And of course, the team picked a sample and they took it. In less than 24 hours, it tested positive for Ebola. That was on 19th September. So in the morning of 20th, the Ministry of Health declared an outbreak. maybe to educate the public for viral hemorrhagic fevers where Ebola is among other diseases including Marburg. Just one case is tantamount to an outbreak. So once the outbreak was declared, the team was assembled, the rapid response team was sent by Ministry of Health, and the teams on ground in Mubende, they were assembled, and of course the contact tracing started to follow up where this case came from, and it was discovered that before this case, 19 cases had already happened. 19 people had already died in the community, and people thought this was a strange illness. Others had gone to witch doctors. Even the witch doctor where they went died, and the situation was very, very alarming. We thank God, with the experience that we have gained over time, we were able to rapidly trace where these cases were coming from, and were able to get it under control. Unfortunately, along the way, some communities, being Africans, you know, there are people who still have these African beliefs, and they still had issues with trusting our health workers. Others were not adhering to our guidance, and
please, Dr. Nahabwe, listen. I want you to tell us exactly how, what challenges possibly you encountered during this fight, and how these challenges were managed, so that you managed or you registered a record time in controlling such an outbreak, and take us into those challenges possibly. You as frontline workers, health workers, you must have encountered challenges along the way in this Ebola fight, and that is what we would want to know. I don't know if you can share some of those really serious stories. Shortly connecting with Dr. Nahabwe Alon, and he is from Mulago Hospital, part of that group of very courageous and brave medical practitioners who were on the front line in the battle, in the fight against the Ebola outbreak in the districts of Kasanda and Mubende. Remember, the epicenter of this particular outbreak was in Mubende, and later Kasanda also became a center of attention, especially after very many cases were discovered in that particular district. And like I said in the beginning, this is not just a fight, because we lost 55 people, 55 lives were lost in this particular fight, and among them, 6 of them were health workers, like Dr. Nahabwe said. And it is a serious fight when you lose 6 actually, 6. If you lose 6 of your best frontline soldiers, it is a serious fight we have had. But thank God, on the 11th day of January 2023, the World Health Organization, together with authorities in Uganda, declared the country Ebola free, which is another success story in the bag, considering other previous outbreaks of Ebola virus. One of, I think the most recent was of 2012, in which we lost many lives, and the highlight of those previous Ebola fights include the death of Dr. Matthew Rukwia, who is now considered as a hero of this country, who laid his life on the line to fight for Ugandans in the fight against the Ebola virus outbreak. And here it came back again starting in Mubende. It had spread to very many districts, including Kampala, Wakiso, Bukoma and Simbi, including Rwengo, and several other areas like Masaka City. Jinja City was also part of that that long list of districts which were, of course, which registered cases of Ebola in this particular outbreak. Well, it can be attributed to the previous experiences we've had with this particular virus, the Ebola virus disease, but again, we must applaud the people and all the teams who were behind this particular fight, looking at how they managed this particular, and not particular, but serious outbreak and dangerous disease, the Ebola virus disease, in a space of only 113 days. That is more or less of 4 months. And that is why I hope Dr. Nahabwe Aaron said it is a record. It is a record in itself that an outbreak of this magnitude can be contained in just 4 months. Looking at the countries that have been ravaged by this particular virus, it ravaged countries in West Africa, and of course there is always a case popping up now and then in the Democratic Republic of Congo. We had to send teams to Liberia, send teams to those West African countries to fight this particular virus. But again, when it comes back to this particular fight, we must applaud everyone who threw in their weight to ensure that the Ebola virus disease is controlled and managed well. It may have claimed 55 lives, but well, we must thank God that it has not remained here. It remained with us. Now that we have counted 42 consecutive days without any single case, without any new case in 42 consecutive days, then from that particular trend, the World Health Organization had to come out and declare Uganda as an Ebola-free country. We would like to connect with our guest down there in Gayaza, Dr. Nahabwe Aaron, and ask him about what he thinks about this fight. He has been on the front line. He has been in the trenches trying to fight this disease, and indeed they succeeded. And from the words of the head of the World Health Organization, it was successfully controlled. The Ebola outbreak was successfully controlled, and in their description, they say it was a robust and comprehensive response that the country, Uganda, did put up in this fight against Ebola disease. I don't know if we can again connect with Dr. Nahabwe Aaron, medical worker from Mulago Hospital, and I've been told he is also the spokesperson. Okay, Dr. Nahabwe, you are back, and let's go straight to the challenges. We need you to do that in just a few minutes. Tell us about the challenges you encountered as frontline health workers in the fight against Ebola in Kasanda and Bumende districts.
Yes, thank you very much. Our host tonight, maybe you had lost me. I mentioned that the first challenge initially was the personal protective equipments. They were inadequate at the start of the epidemic, to the extent that when we visited the Mubende Ebola treatment unit, a team from the Uganda Medical Association, where I was among as the chair of welfare, we found that some of the PPEs they used, the coveralls, the gloves, were not enough, and thank God the development partners like WHO, Bayer, and other partners came in and they supplied, and our health workers were protected. The other challenge was inadequate staff, which still is a big issue. Mind you, our doctor-patient ratio in Uganda is 1 doctor to over 25,000 patients, and this is very, very catastrophic in times of outbreaks, because even the few doctors available, you have, and other health workers for that matter, you have to remove them and put them at either in the isolation facilities or the screening areas. And you cannot work in other wards because you are more exposed. So the staffing has been a big challenge. We thank the UPDF team that came in to reinforce us and boost this staff challenge. I can give you an example. For example, at Mulago Hospital, you remember we had a national isolation facility, and we're also screening other suspects that enter the hospital. So we had, at the peak of the epidemic, the team that was doing this for Mulago particularly, we have 4 doctors instead of over 10. We had 8 nurses instead of over 22. Of course, in the national isolation facility, they had more staff. They were the ones manning the area that had suspects. A team from UPDF was there in charge, and we had at least more staff. But that was the same case in Mubende. The staff has been a challenge in this outbreak. The welfare bit, where the risk allowances have been up to now, some people have not been paid, including myself, and we still call upon the ministry to pay those allowances, because our team risked their lives. When all of you were at home sleeping, we were on the front line, seeing patients, seeing cases who are suspects, treating those who were sick. So please do us a favor and pay that risk allowance. Things to do with contracts. Most of the workers that were working were on a volunteer basis, and as the Uganda Medical Association, we called upon the ministry to give them contracts. You cannot work in such a risk area without a clear contract. In case you get you get exposed and you acquire Ebola, for example, how do we deal with you? You cannot be compensated because there is nothing that shows that you have been working. So we had staff who were working without contracts, and they were just volunteers, and that would demotivate them. At certain points, you would feel, who even knows that I'm working? So that was a big demotivator, and we asked the ministry to work on this. In the next time it happens, please give contract.
Dr. Nahabwe,
we had things
thank you like, so much, Dr. Nahabwe. Our time is running out, and
yes, please.
I just can give you only 30 seconds. Speak to, of course, Ugandans. Speak to Ugandans, especially on your collaboration in such epidemics. Speak with them in just 1 minute.
Okay, thank you very much. To the Ugandans, we want to thank you for the cooperation and still ask you to keep alert. This is not a time to congregate again. Continue doing infection prevention and control measures. Wash your hands. We are still suspending things like hugs, things like getting so close. Let's continue watching. If anyone falls sick and they have fever, they have vomiting, they are diuretic, they are passing blood, and they must take them to the nearest health facility. And once the basic investigations are done and there are the common illnesses are not detected, that could be an Ebola suspect. Some people who have recovered from Ebola, we want to ask you to receive them in the communities. They are still not contagious. However, there is science that says some of the viruses can be sustained in the body, in some parts like the semen for the males, and so for that matter, we would advise that you will continue having protected sexual intercourse for a period of at least 12 months from when you recovered. So continue protecting yourselves.
Thank you so much. Thank you so much, Doctor. Thank you so much, Dr. Nahabwe Aloni, for your time. And before even government pays your risk allowance, allow me and all of us here at Salt Media to appreciate your courage, your bravery in fixing this big and serious problem fighting the Ebola disease. Thank you so much, our frontline workers. Thank you so much, all the stakeholders in this fight. Thank you so much to everyone who threw in an effort to fight the Ebola virus. My name is Tim Apollo. I must say, let's keep watch. We never know when this can come back. Good evening and a splendid weekend.